Hi, it's Marcus Cheatham at the Mid-Michigan District Health Department, serving Clinton, Gratiot, and Montcalm counties in central Michigan. And it is January 21st, and I've got an update for you about the rollout of the COVID-19 vaccines, the Pfizer and the Moderna vaccine. They're slowly coming into the community. And what I want to talk about is what you're going to see over the coming weeks. We've started to get more and more information about where the vaccine is going to be available, where it's going to appear, and what that timeline is going to be. So I want to share that with you right now. Got a little data presentation for you. And so let me see if I can get my screen going here. And there it goes. So in order to understand what's going to happen, we need to know a few things. So first of all, who are we going to vaccinate? Who's the target population that we have to reach? And what we want to do is reduce mortality as much as possible. Then how are the vaccines coming into the community? Where are they going? How many are there? That's the really big question. How big is the supply of vaccines? A lot of people want it. Not many people are getting it right now. And with that information, who we have to vaccinate and the supply, we can calculate how long is this going to take? So people want to know, how long is it going to take before I'm going to get vaccinated? We can answer that question. And then we can talk about the logistics that are required. Who's going to be doing the vaccination? Where are they going to be doing it? Where are you going to sign up? Where are you going to go? So we'll see that. So first of all, the target population. So we call the target population group 1A and 1B. And so the group 1A is healthcare personnel, the people who are taking care of people who have COVID. They're serving us, keeping us alive, and obviously they need to be vaccinated so they don't get the disease themselves, infect their families, and things like that. Then we want to vaccinate vulnerable people, the people who are likely to die of this disease. We want to stop the mortality. The past few weeks, the death rate in central Michigan has been twice as high as normal, and that was the fault of COVID. So we want to reduce that. So we need to take care of people in long-term care. We need to take care of people who are over 75. Actually, in Michigan, it's 65 and older. We want to take care of people with high-risk conditions, diabetes, heart conditions, things like this, like where COVID can kill them. And then we have certain essential workers that we need to vaccinate because they keep the community going. They keep our economy going. So an example is, I say this on every one of these videos, snowplow drivers. If the roads aren't cleared, all the businesses are closed, the food doesn't get delivered, etc. So there's a few groups of essential workers we need to vaccinate. So somebody who works for me, his name is Rex. Rex used the census data and some survey data, and he counted for our three counties, Clinton, Gratiot, and Montcalm, how many people are in these groups. And there's over 100,000 of them. But not all of them will accept the vaccine. So we assume that about 70% will accept the vaccine. I'm afraid it's not going to be that high, but that's what the goal the state has set for us. So that's 71,993 people who we need to vaccinate, 70,000 people. So that's our goal. That's our target population. All right, so how is the vaccine coming into the community? The state, the Michigan Department of Health and Human Services, is allocating the vaccine between health departments and healthcare providers. And there have been two big shipments that have come in. One right around Christmas time, that's this first line up here. And then another one recently that came to us. And so the health department got in total from these two shipments, 3,200 doses of vaccine. All of it that came to the health department was Moderna. And then healthcare in our three counties got 14,950 doses. So I want you to notice that most of the vaccine went to healthcare, not to the health department. The total was 18,150. So please tell your friends when they scream about there's no vaccine at the health department, it's really true. We only got 3,000 doses. There's a lot of other places to get vaccinated. And I will be talking about that here in just a minute. Now, there were some other vaccines that came into the community. So CVS Pharmacy has been vaccinating people in long-term care. And when they're all done with that, that'll amount to a little over 3,000 doses. Those weren't distributed directly by Health and Human Services. That's indirect distribution. But when you add all of this up, you get 21,350 doses. So roughly 20,000 doses for 70,000 people. So we can do a little arithmetic here. And when we do the arithmetic, we can see it's going to take us a little more than 3 months to do everybody in group 1A and 1B. Here's the arithmetic. 70,000 persons, they each need 2 doses. That's 140,000 shots that we have to give. We have been told not to expect the flow of vaccine to increase very much. So it's going to keep coming, like this, about 10,000 doses a week. So if you take 140,000 and divide it by 10,000, you get 14 weeks. That's easy arithmetic. So if nothing changes, it's going to take us 14 weeks so it'll take us, basically up till April to vaccinate everybody in group 1A and 1B. That's the high risk population. There's still a lot of other people who are going to want the vaccine, but this is to curb the mortality. This is to cut down on the death rate. So very, very important to do this. Now, something may change. For example, the Johnson & Johnson vaccine or the AstraZeneca may come on, and we may start getting those. Those are 1-dose vaccines. I hope that happens. The supply of Pfizer and Moderna might increase. We've been warned that that probably won't happen, but what if it does? So maybe this will go faster. We'll see. So then what are the logistics? What are we going to be seeing in terms of how are we going to get through these 14 weeks and vaccinate everybody? 4 things to remember. First of all, the health department at its campuses in St. John's, St. Louis, and St. John's, Ithaca, and Stanton can do about 3,000 people a week. Out of that facility, we can do about 3,000 people a week. Those are small buildings. We have a limited supply of nurses. That's what we can do. So we need to vaccinate 7,000 other people a week to get to our goal. Where are these other 7,000 people going to get vaccinated? Well, the first is community-based clinics in alternate locations. The health department is going to help to set these up, and we've already been doing that, as a matter of fact. We don't have enough nurses to do community clinics, so we're going to get nurses from other sources. We've got volunteers, we've got contractors. There's other folks like the National Guard who will come and help us do this. The National Guard has already been working with us. They've been doing our adult foster care facilities. We've already had volunteers. We had school nurses from the Gracia de Isabella RESD that have been volunteering with us. And we have contracts with Optimal Staffing, with Spectrum Health, so we can get contract nurses. We don't need contract nurses right now because the vaccine supply is so limited. But those contracts are ready to go as soon as we get more vaccine. Then you're going to see pharmacy vaccinations. So the major pharmacies are already stepping up. This is so important because people are used to getting vaccines at their pharmacy. They're used to going there and getting their flu shot. This is familiar. People will do this. So you can already sign up at Meijer to get vaccinated. Now everybody's going to Meijer to sign up, and Meijer only has a little bit of vaccine. So if you sign up at Meijer, you might have to wait, 14 weeks, but it's a place you can sign up right now. The other pharmacies, if you go to their websites, you'll see they're getting ready to start their own pharmacy programs. The health department is actually going to give some vaccine to Meijer, some of our vaccine to Meijer, so that they can get going on their own program. So this is already happening. So these community-based clinics, we're already doing them. Pharmacy vaccinations are already happening. Most important, other healthcare providers, doctors, the hospitals are starting to vaccinate their own patients. All of the healthcare providers in our jurisdiction, Sparrow, Mid-Michigan, Spectrum Health, and McLaren does, some patients in Clinton County. All of them, if you go to their website, right on the homepage, you can click to sign up and get vaccinated. Um, Sparrow's already pushing the vaccine out to their practices, their associated providers. So it's worth it to contact your doctor and say, when do you think you're going to get the vaccine? I'm ready to go. Remember, 90% of the population has health insurance. 90% of the population has a doctor. So this is really important to do this. Mid-Michigan, you can't sign up for them because they're actually calling their patients themselves. They're starting with the oldest and most vulnerable people and working down. So if you're 65 and otherwise healthy, it might be a few weeks till they call you if you're a mid-Michigan patient, but they're working their way through their list. And the hospitals are also doing some community clinics. So for example, in Clinton County, Sparrow Hospital did 150 school teachers. This stuff is happening right now. It's it's still going to take 14 weeks unless something major changes. But I'm just letting you know this is happening. This is a lot of information. How do I find my way? Where am I supposed to go? So the Mid-Michigan District Health Department is going to have the links to all of these things on our website. So you can go and you can see all the healthcare providers. You can see the health department schedule. It's full right now. It'll open up in a few weeks. You'll see the information for how to sign up at pharmacies. All of that's going to be there. We know that a lot of folks are not computer savvy. Some of them don't use the internet at all. They may have trouble, with their patient portal and signing up for their vaccine and all of that. So please help your family members. Please help your neighbors. And then we are going to be working with the area agencies on aging. And we have a staff member at our own health department. And we'll be having people who you'll be able to call, and 211 will be able to help also. So call 211 to help you sign up if you're having trouble doing that. We'll also be arranging for transportation with the area agencies on aging. So people who don't have transportation can get it and get vaccinated. So stay tuned, look at our website. All of this stuff is happening right now. It's really, 2 or 3 weeks ago, I didn't know this information. It wasn't happening. So I'm so glad to be coming to you now and telling you that, the vaccine is starting to appear and there's places for you to go. The last thing I'm going to leave you with is the following thought. We have enough vaccine for 10% of, 15% of the population right now. So with every week that passes, it's going to go up from 15% to 20% to 25%. We're making our way to our goal. And by the time the snow starts to melt, all of our vulnerable folks will be vaccinated and we will start to be safe from this disease. Thank you very much. I'll be back next week with another video from the Mid-Michigan District Health Department. Thanks a lot, folks.